So we're going to look at a test now called the VBI test or the VAI test. It's the same test, goes by two different names, the vertebral basilar insufficiency test or the vertebral artery insufficiency test. So the basilar artery is the artery that goes up through the cervical spine, loops around at the top and goes into the brain. As you can imagine, very important artery supplying the brain with blood. In some situations there's some encroachment on that artery due to various different factors, but often it's a structural deformity in the cervical spine that can cause compression in the artery and interrupt that blood supply. If a patient presents with that problem, with that presentation, you do need to get them to the hospital. It's considered a medical emergency in some situations. If they were to sustain a knock, have a car accident, something like that with whiplash, it can be potentially very, very dangerous. So this is a really important test to do to screen someone's cervical spine, particularly if you're going to be doing any manual therapy techniques that take the head into extension with rotation. So a lot of the techniques we do for this, the SCN in particular, involve that movement. So if you are having to do those kind of techniques, this is a good test to do first. Also, if the patient's presenting to you with symptoms of dizziness, blurred vision, altered vision, nausea, those kind of things with particular neck movements or neck positions, any of those symptoms are a good idea to then do this test. The way we're going to do this test is ask our patient to put their hands out in front, palms up, and then from here we choose a side. We're going to ask them to look over their right shoulder towards the top corner of the ceiling. So they lean over, look away on that angle. They're going to hold that position for about 10 to 20 seconds. While they're in that position, we're asking them if they're feeling nauseous, if they're feeling dizzy at all, and then we're watching what these arms are doing. If there's some compression happening in one of those arteries in that position, what you'll sometimes see is one arm drop slightly as the blood supply to the brain on that side is impaired. It can impair motor control on that side, and then it comes back. Also, when it comes back to this position, you need to stand in front of them, look at them in the eye, and we're looking for something called nystagmus, which is the eyes kind of beating around. So if the pupils move, if there's some uncontrolled movement in the pupils in that position, that can also be a positive sign for the VBI or the VAI encroachment of that artery. So just to recap again, in this position, looking over to one side, you do it to both sides to compare, left and right, in holding that for about 20 seconds or so, coming back and checking for any dropping or movement of the arms, feelings of nausea, feelings of being dizzy, acute pain in the neck, of course, as well, and then any nystagmus at the eyes. If any of those symptoms appear and they're triggered by that position, it's a good idea to refer that patient off to the hospital straight away, just to be sure, to make sure that you have cleared that VBI encroachment before you do any manual therapy techniques on that person.